Welcome back to a special mini podcast series on cancer care during the COVID-19 pandemic. Today, how to foster staff resiliency and keep morale up during the pandemic. Krista Nelson is the Program Manager of Quality and Research, Cancer Support Services, and Compassion at Providence Cancer Institute in Providence, Oregon. She's also ACCC's 2021 President-Elect.
Within the Providence Cancer Institute, the oncology social work team, the first thing we did is we set up a survey within teams and sent it out to all clinic and hospital staff and offered support around coping with COVID. I think the oncology social work team knew that we had an expertise in providing support around uncertainty, and we also had a belief that we know that it's normal to be having a hard time right now. So we ended up getting self-referrals from radiation, inpatient, clinic staff, all specialties, and are able to offer phone support as well as FaceTime support to colleagues in the moment. And it was set up very quickly and available ongoing still to this day. One of the other things the social work staff did is we laminated these self-care tip sheets and we put them in the bathrooms. We also put up song lyrics of Jolene and Living on a Prayer for hand washing in the bathrooms. And then we laminated these little mantra cards above the wall Purell dispensers. And those said things like, I am strong, I have what I need, and I've got this. So I think Providence, that was sort of the intervention, the social work team. On a bigger scale, our behaviorists at Providence started a concierge service, mostly made up of psychologists that were available to all caregivers, we call our employees caregivers here, for 10, 30-minute visits for free, as much video or on the phone to get support around this time if they wanted.
Those are really creative suggestions. How about fostering that support for your teams?
One of the things that we did was we started something we call virtual connecting conversations. And these are Zoom meetings that are offered to units that have been specifically impacted by COVID. They're professionally facilitated and offered throughout the week for people to connect. They're done in both the clinic setting and on inpatient nursing units. So the kits we created include things like handouts. They include how to be a compassionate caregiver, how to have a difficult discussion with a caregiver who may appear stressed, maybe tips on how to lead a virtual meeting, how to maintain productivity. We include videos and individual meditations in these kits. And each kit also has ideas that teams can use for huddles. An example of that might be at the beginning of in-person meeting or huddle of the day, caregivers sharing something that they're grateful for, or if it's a virtual team, having caregivers share something that brings them comfort during this time. And that's an opportunity where you can see pets and favorite blankets. One of the things our teams here have done that I would really encourage is the use of Zoom or an opportunity for people to connect. I think the other piece is as leaders and providers of cancer care is acknowledging just how much everything has changed. And we need to allow ourselves to grieve and to nurture ourselves. I found even creating a ritual at the end of the day, even if I'm working from home, and maybe that's a mantra. So the one that I say to myself is, may I know that I've done my best today and that I can come tomorrow renewed. May I be healthy and live with ease, and may I be filled with happiness and well-being. I have that printed above my screen, and I say that as I close my day. I think that just acknowledging that everybody copes in different ways, and we've been inundated with ways through the internet and through blogs and webinars of how we can cope. But I think just taking the time to pause, to connect with yourself and with your team, how you're actually doing, and then also taking your own emotional temperature and really figuring out, knowing that you yourself will impact, it can be contagious. So the kindness or the stress, all those things can be as contagious as COVID-19.
Check out the show notes for more on staff resiliency and well-being. Next week on Cancer Buzz, we'll talk to a young breast cancer survivor about the unique needs of younger patients with cancer, things like oncofertility and family planning and working while undergoing treatment. Until then, for the Cancer Buzz team, this is Summer Johnson. Stay well.